Hello everyone, my name is Dr. Carlo Oger. I am an emergency physician and I have a special interest in the subject I'm going to talk to you about today. But before you know why I have a special interest, let's talk about it. Today is World Encephalitis Day, an awareness day to the diagnosis and the illness of encephalitis. Today is 2/22. February 22nd is World Encephalitis Day. What is encephalitis? Encephalitis is an inflammation or swelling of the brain, as opposed to meningitis, in which the surface of the brain is affected, as opposed to myelitis, in which the white matter part of the brain is affected. In encephalitis, the whole brain, even the meninges, the brain tissue, the middle part of the brain, everything is swollen and inflamed. Here in the next picture, I'll show you a picture of some inflammation, swelling, and redness of the brain. And a little bit more graphic picture of an actual brain that was taken out of somebody who died of encephalitis. You can see the destruction of the tissue, the redness, the bleeding spots. That is what encephalitis is. What are the symptoms of encephalitis? That includes headaches, neck stiffness, paralysis where the muscles aren't working. Of course, weakness goes along with that. High fevers and chills, disorientation, decreased levels of consciousness, even coma where they're totally unresponsive. Tremors and convulsions, even seizures are also symptoms of encephalitis. Most encephalitis are viral, but there are also non-viral, which are bacterial causes of encephalitis, and even non-infectious encephalitis, in which no infection actually causes inflammation, but rather other diseases. Let's first talk about the other causes of encephalitis. These include allergic reaction to even medications and vaccinations, or anything introduced into your body that creates a reaction to it and then go ahead and attack the brain in response. Autoimmune disease is one that has many different subclasses of encephalitis. Acute disseminated encephalitis, NMDA receptor antibody encephalitis, voltage-gated potassium channel complex antibody, Hashimoto's, which has to do with thyroid, and Rasmussen's encephalitis. There's also bacteria-caused encephalitis, like the one that causes Lyme disease, the one that causes syphilis, and even tuberculosis. Parasites, so not bacteria, not viruses, but parasites like roundworms and cysticercosis and toxoplasmosis, which is more common in AIDS patients. And even cancer can form encephalitis in the brain. Now let's talk about the viral causes of encephalitis. This HSV virus 1, HSV 2, varicella zoster, CMV or cytomegalovirus, Epstein-Barr virus, and others. But many other relatively common viruses like adenovirus, which is the common cold, influenza, which we know it's going around a lot, enteroviruses like the poliovirus, measles, mumps, rubella, MMR, rabies. That's why people get, the dogs get crazy and angry and convulsions and foam out of their mind, because they actually get encephalitis. And there's a whole bunch of them that are caused by mosquito bite, the arbovirus family. That's Japanese encephalitis, St. Louis, West Nile encephalitis, Western equine, which is horse related, and La Crosse encephalitis, a Colorado tick, so a tick bite can cause encephalitis, etc. Now let's go ahead and talk about the symptoms more specifically of HSV encephalitis, which seems to be one of the more common types of encephalitis. Symptoms of HSE encephalitis, acute or subacute, cause fevers and chills and headaches and psychiatric symptoms. The patient actually starts acting not well and confused and saying the wrong things, nausea and vomiting, weakness, memory loss, concentration issues like altered level of sensorium. You can start getting weak and paralysis, numbness, cranial nerve deficits. Some of the nerves of the face can start getting affected and then cause focal weakness. Visual field loss, they can actually lose field of vision. And of course, with the swelling of the brain, swelling of the back part of the eye causes papilledema. If you suspect a patient has encephalitis, it's not an easy diagnosis. Most of the time, doctors like myself are totally unaware of the symptoms because it's a pretty rare disease. And the symptoms are so similar to the common cold. headache, fever, chills, feeling sick, weakness. It's just very vague when it starts, what is called the prodrome phase, until it starts showing up with seizures, confusion, altered sensorium. We're really not thinking about encephalitis. But if you do suspect encephalitis, there are a couple tests, of course, blood work, but also imaging of the brain. We're going to perform a CT scan, a computerized tomography, in which we could see evidence of swelling in the brain. But an MRI, a magnetic resonance imaging, will show far more detail, and you can see way more of the fire of this disease, the inflammation across the brain tissue. As long as the patient doesn't have evidence of increased intracranial pressure, a lumbar puncture can be performed, in which a needle is put in the back of the spine, fluid is drawn, and then analyzed for the virus. This can be done through PCR and different kind of techniques, antibody testing for if you think it's autoimmune encephalitis, and cultures if you think it's bacterial, parasite, and so on. So at the beginning of the video, I said that I have a special interest in encephalitis, and this is because 4 years ago now, in December, so a couple months before now, my wife got encephalitis. And I, being a physician, missed the diagnosis for the first week, basically because my children had the flu, cold, congestion, fever, headaches. And when she got sick, I thought it was the same. I actually took her to the emergency department about 5 days into the illness, and same thing. She got some fluid, she got some blood work, she was told she had the flu. We sent her home with pain medication, and she felt better. But a couple days later, the confusion started acting up. She could no longer read text. She could no longer send text that made any sense. She started calling me mother and started kind of looking up into the sky like this and smacking her lip. At that point, I realized how sick she was. Put her in the car. She was trying to jump out of the vehicle. I had to pretty much put the seatbelt on her, throw her in there, and take her to the emergency department. We performed a CT scan within minutes of arrival to the ER. We showed the swelling, mostly with the temporal part of the brain, which has to do a lot with the memory. And that's why long-term effects of encephalitis are serious. Different kinds have different long-term effects. For example, if you catch it early, the disease shows up with less deficits. If it's autoimmune and you treat it with steroids and immune globulins, patients can get a lot better, seems like, than people who have HSV, because HSV actually causes that tissue destruction and permanent injury and damage. But every encephalitis is going to be different. Every patient is going to be different. But for my wife, long-term, 4 years out, it's a lot of memory problems still. She's learned to cope with it. She's learning to live with it. But also affected a lot her frontal lobe, which has to do with mood and anxieties and stress and frustrations. And she gets a lot of that. So we have to do some psychiatric medication to help her with that. She did have petit mal seizures at the onset of the disease. That was the eye fluttering and lip smacking, but that didn't last and it didn't turn into a seizure disorder, thank goodness. So anyway, that's why my special interest in encephalitis. This is why this day is so special to me. This is why I, as an emergency physician, have a lot more awareness of the encephalitis, and I want to take this moment to share with you all. And hopefully you like the video, you share it, you comment on it. If you know someone or know of someone with encephalitis, then please share it, remind them of the day. And thank you for watching this video, okay? See you later. Bye-bye.